Amnesty International Kenya and the Kenya Medical Practitioners, Pharmacists and Dentists Union-KMPDU want the government to allocate at least 1% of the national budget for procurement of Covid-19 vaccines for the entire adult population. This as the country recorded 589 new coronavirus infections from a sample size of 4,995 tested in the last 24 hours, bringing the positivity rate to 11.8%.
Hours before National Treasury Cabinet Secretary Ukur Yatani presents the national budget for the financial year 2021-2022, 8 lobby groups led by Amnesty International Kenya have raised concerns that the proposed budget has failed to specify any significant allocation for the purchase of the Covid-19 vaccines.
We are deeply worried that despite the shocks to all aspects of life and livelihoods due to Covid-19, the national budget healthcare, including what is spent at the county level, is still at 8%, not 15%, and is way below the requirements of the Abuja Declaration 20 years down the line.
According to the lobby groups, the estimated total cost of vaccinating the entire adult population in the country is 35 billion shillings, which represents only 1% of the projected national budget for the financial year 2021-2022.
For the last few months, we've been depending on the COVID that has been donated. For example, the last 350,000 doses that came from Denmark, the other 120,000 doses that came, some are from Congo and some are from South Sudan. So we actually need the country or the government also to budget and purchase the vaccine for its population.
In addition, the groups want the government to increase the health sector allocation to 15% and allocate funds to subsidize cost of COVID-19 testing and treatment.
It's important that we increase both health allocation to ensure that health workers remain adequately resourced to support the people through the public healthcare system. The support should include necessary equipment, protective gear, and research for all health workers.
The concerns coming as the country recorded 589 positive cases of COVID-19 from a sample size of 4,995 tested in the last 24 hours. This bringing the positivity rate to 11.8%. According to the Ministry of Health, 19 people have succumbed to the disease to bring total fatalities in the country to 3,345. Total confirmed cases are 173,661, bringing the cumulative tests to 1,845,884. In terms of distribution, Kisumu County is leading with 100 cases, Nairobi 91, Bungoma 60, Homa Bay 54, Siaya 49, Uasin Gishu 37, and Busia 32 cases.
We are working closely with the Kisumu County COVID-19 Multi-Agency Committee to ensure that the measures are put in place to contain further spread of the virus.
312 patients have recovered from the disease, 128 from various health facilities countrywide, while 184 from the home-based and isolation care program. With the number of recoveries increasing in the recent weeks, and total recoveries now standing at 118,933, the Council of Governors says county governments will take drastic actions to ensure compliance of COVID-19 prevention guidelines.
The county government will continue to play their critical role as far as liquor licensing is concerned, and also strict enforcement of the guidelines. In view of this, county governments will take drastic measures, including suspension of licenses to unscrupulous operators.
Ben Chumba, reporting for Channel 1 News.